Hi, I'm Michael Hoxton from HoxtonHealth.com. Today I'd like to discuss a little bit what I call a pink elephant in the middle of the room, and it concerns patients of physical therapy and their right to be aware of certain things. Because as a patient, you always have a choice of the type and quality of care that you're receiving. Now, just because your insurance company says that you only have a certain amount of treatments or you can only see a certain amount of therapists in your area, so to speak, that are in your plan, doesn't mean that you have to go along with that. Okay, for example, let's say you see somebody in your area because they're close and they're in your plan, and you have a condition that's not as straightforward, it's a little complex, and it's been bothering you, it's preventing you from living your life and enjoying your life, so to speak. And it just so happens the only people around you, you've tried, one, or you've tried a couple of them, and they're just not doing anything for you. It's not their fault, it's not your fault, it's not the insurance plan's fault. It's just what it is, that you're not getting the proper care, you're not feeling any better improvement with the care that you've been having. So you always have a choice. Now, you might not need a physical therapist. You might need to see a chiropractor or a massage therapist, or maybe it's something where you need more movement. You see a personal trainer, or maybe even a yoga instructor. It's really up to you to be informed of what's out there. Just because your medical doctor prescribes physical therapy, not for all cases, doesn't necessarily mean that you need physical therapy, okay? But I'm just here in this video to share with you, to give you another perspective so that you become empowered to make a more aware choice, okay, of your health care, okay? Because sometimes with healthcare today, the physical therapist, I know this from firsthand experience, they're not getting paid as much as they used to through insurance reimbursements. And the insurance companies are really the dictators, so to speak, in healthcare. They rule how much they'll pay or reimburse the provider, the therapist, and how much care they can give to the patient. So based on whatever parameters they do from their research or whatever it may be. So what I'm saying is they limit a patient's care. They limit a patient's improvement, so to speak. So the therapy profession tries to do their best of providing the best evidence of showing that what they're doing is helping the patient. But also, as running a business, what they do, because they have to run a business, they have to increase the patient volume. So you're no longer, well, you never really were, the only patient in the office. Therapist comes in, an aide comes in, or an assistant comes in, whatever it may be. There's a lot of stuff going on, and that therapist is going to be distracted from giving you individual attention. Even though they might be working with you one-on-one, they're going to be still distracted from their business and the other patients, 3 or 4 other patients that are there at the same time that you are in their practice. So when a mind is distracted, it cannot pay attention to what's before them. Okay, that's what I'm trying to get here. So when you see somebody that does not accept any insurance anymore, there's a lot of practices, at least in New York City, there's a lot of practices that do that because they just see the joke, or how ridiculous it is of working with the system as far as the insurance companies, and how ridiculous it is and how it's limiting the provider and actually providing true health care. So they became rebels and got their business running. And the reason why people are paying out of pocket is because they're good. Okay? Not all the time, but usually when you see a practice where they don't accept any insurance, they're good, that they could stand alone as a business and still provide great care. So that's what I did. In my practice at Hoxton Health here in Howard Beach, New York, I haven't accepted insurance for 2 years. I still get calls every week asking if I accept this plan or that plan. And I just don't, because I got tired of it, and it was actually deteriorating my health. All right, so just like I put my foot down and I made a decision to close all my back doors and just cut out all insurance policies, all insurance plans, now people pay me out of pocket. But when they pay me for a half hour, an hour, how much time to see me, they see me for that amount of time, okay? And I give them all of my attention. I don't have to worry about seeing 3 or 4 other patients at the same time that they're visit. When you make an appointment in my office, you're the only one at that office. So that one-on-one attention really saves in the long run, because if I can help you realize what health is and help you find meaning in your life, or help you feel better, faster, then that was a good investment, now wasn't it? All right, so this is just a quick blurb, a quick sharing with you of becoming more aware, and if you are receiving physical therapy, or if you know someone else receiving physical therapy, there are other options, and you always have the power of choice. You just have to be more aware and pay more attention. Okay, so have a great day. That's enough for today, and be good.